what you're going to have is an onion layer approach. In the middle of the world is the patient and the patient's data, and then you have different types of security solutions that surround that in different layers. Whenever we go out and we're talking about different solutions that we're trying to provide or sell or even look at, the first thing is security has to be table stakes. Here's what we do, here's how we provide it. And if we can't get beyond that in a few minutes, nothing else is going to matter, right? So whether it's an actual customer or a patient, which is your customer too, if they don't feel that trust based on how you manage data today, they're not going to want to move forward with the next step, whatever the next step might be.
Hi, everybody. Welcome to another podcast from Zenex. I'm very pleased to have a industry leader, Nayan Patel, who has a very interesting background. He wears two different hats. To kick off this podcast, and tell us about your role at FinTribe and your advisory work and how trust shows up across both. Let's start with that.
Yeah, so my name's Nayan Patel. I've been in the healthcare IT industry for about 20 years now. Prior to that, I was in semiconductors. I'm a former hospital CIO, really just focused on using technology to drive business outcomes. I think that's the short skinny of it. At FinThrive, we're a revenue cycle management platform, and our goal is to help hospitals improve their bottom line. But in addition to that, as I mentioned, being a former hospital CIO, I'm always looking to provide advisory services to any organization that is really trying to utilize technology to help improve the bottom line at hospitals, understanding patient care at a different level. At a broad level, that's a little bit about me.
So, Nayan, you operate in both enterprise leadership and advisory work across healthcare technology. How do you think about building trust and clarity across environments that vary widely in maturity, complexity, and regulatory pressure?
I think the first thing in order to build trust is to understand the organization and whoever you're working with. In the way we look at it is everybody is your customer, internal or external. They're your customer. And so you want to provide for them. And so to build that trust, you really need to spend time with them, understand what their pain points are. And that usually, whenever I join a new organization or even when I meet somebody, it's relationship building. So the trust is all relationship building. And it's first, no agenda. It's just tell me about yourself type of thing. And then you learn more about one another. And then you kind of take deeper questions into understanding what their pain points are, what are their areas that they feel challenged with. And you're not there to problem solve on day one, but you're trying to understand first and then maybe come back a few more times. And then you might be able to provide some guidance, especially if you have joined a recent organization. Then after you learn what the issues are, then you come back with some recommendations and then you just kind of build from there. But it's all about that relationship, continuous building.
Well, healthcare organizations are complex organizations, right? Obviously.
Absolutely.
You've got doctors, clinics, operating rooms, practitioners, billing, insurance companies. It's just a complex set of issues that come with healthcare. How do you create trust across these different stakeholders in this ecosystem? Because they have different needs and you have to address all of those stakeholders' needs. How do you go about doing that?
Well, as I mentioned, you do have to have one-on-one meetings, right? You can't establish trust in a large group environment. And so each of these stakeholders that you're describing, you're right. There are different needs where it's the nursing side or the physician side or even in a patient care room facility, there are different needs. And once you understand some of the challenges, as we talked about, that are available for everybody, then you're just trying to tie it back to the business. Ultimately, every hospital as an organization is there for patient care, but patient care isn't going to happen unless you have money, unless you have inventory of whatever supplies that you need. You have to have the right equipment to provide the proper patient care from a nursing perspective. So that you're right, it is complex, but you have to take a few problems, maybe prioritize one or two, and then seeing how everybody can work together to make that one area improve. and then bring it together. It takes a lot of individual meetings and then bringing it back together in small groups and then maybe a large group.
Having said that, how do you bring transparency and clarity and communication for that purpose? I mean, when you look at how many meetings you got to have, and also the more importantly, from a technology perspective, you need to have clarity and transparency, I suppose. And how do you do that in a healthcare organization?
Well, a lot of it is it takes time to understand how each function operates. And then it's not taking the detailed technical view. It's a business problem. Everything is a business problem. So when you're having a nurse have certain challenges, and then also physicians have certain challenges, trying to find what are those things that can be improved in each area to be applied in the other area and vice versa. But it takes a little time to understand what are the business drivers and making sure you can get those aligned. There's no exact way or right answer to all this. It's really identifying what those workflows might be in each of those areas and saying, okay, what can we do to improve X, Y, Z? As an example, the last, 2 years, everybody's been focused on ambient documentation. I mean, that's been a big deal, right? And it's pretty much becoming a standard, and in 2 years it will be table stakes. Everybody will have it, and that's just where the market is moving. So then there'll be other things to focus on. But even getting that deployed with right now in our existing environments, not every physician is ready for it or understands how it can help them reduce their, documentation time, because that's really what it's about. Productivity. It's going to improve quality also, but a lot of it is just simple productivity, and then making sure the value is there and the money that you're spending to put in this new technology. But it has to be aligned with the workflow impact. And both sides, even for nurses, they have to make sure that they benefit in some fashion as well, because they're going to be reading some of the output that comes out of here as they're doing the day-to-day patient care. So it just takes time.
That's an interesting point. I was going to ask you about that. How do you think AI is going to impact healthcare technology over the next, let's say, 2 years? Because it's moving at such rapid speed that the impact is going to be quite high. And with the right implementation, right execution mapped to the workflow, to the business need, and identifying the right business need rather than, oh, let's just do AI, it could make an impact. So how do you see that evolve and impact healthcare technology, let's say over the next 2 years?
Yeah, I think right now AI, and then now you'll hear the term agentic AI are the two things that is all over, and everything you do has to be involving AI of some sort. But at a broad stroke, that if you say what does it mean, it's really about improving productivity. Right. So it's not eliminating roles or anything like that. It's about improving productivity in the different areas. And the key there now is how much productivity gain can you get in these different AI initiatives that are out there. You can apply AI or in some cases it's just RPA, robotic process automation. It's just automation of things through the use of AI. Agentic AI lets you make some decisions automatically. So it's making actual decisions, right? That's what agentic AI is about. But all these things ultimately are improving productivity. So what you have to do is now you have to really do a deeper dive into these workflows and saying if we're trying to automate or improve the outcomes of this, more increase the productivity and efficiency, how does this particular AI effort align with something else in terms of overall productivity gain? Maybe it's minutes, hours, savings, but that does and should translate to some dollar value. So then you really want to tie it back and prioritize. You can apply it in almost every part of a company's workflow today, including healthcare. So you really need to just have almost an initiative to lead all the AI efforts, document them, and then help prioritize them. It's not an easy answer because every day there's an improvement opportunity. But the question is it a significant improvement opportunity that's going to improve the overall efficiency of the organization?
You have a very interesting background, and also because you're fractional CIO, you work with a lot of healthcare organizations. What do you see are the biggest challenges today with healthcare organizations as it relates to security and technologies that they need to deploy? What do you see that is a common problem, and what needs to be done to solve those problems?
The security is everybody has to address it. I mean, that's there. The common problem is, and it's not just security, it's all the other parts of technology and IT in general. There's too many things that we've put in place. So in a healthcare organization, if you're a decent sized organization, you're going to have 400 to 500 applications or technology of some sort that needs to be managed and supported. And that's where the challenges are. It's become so complex. You don't have the ability to just keep everything updated where it needs to be. So the focus area that I think that I've been doing over the last couple of years, and what I do think there is an opportunity for, is application rationalization, right? So doing more with less. So trying to say, as an example, in one of my prior organizations, we had 15 different security solutions. Can we reduce that in half somehow by using more consolidated vendor options? And that was the focus that we did. It's not that you're losing the function, but you're trying to consolidate, just like with you do with an EHR, EMR today. The large EMRs, they do more, right? And that's the whole point. Instead of having multiple applications, just put in one. It may cost you more, but in the end, you're actually saving more time, less invoicing, less support, because it's in one support system. And you don't need, 20 different people to manage 20 systems. Maybe you need 10 to manage 12 systems or whatever it might be. So you try to do more with less through application rationalization. And that applies everywhere, whether it's security, infrastructure, even in our world, revenue cycle. That's what we're trying to do, as a solid revenue cycle platform.
It's so interesting you say that because industry analysts have talked about this consolidation of services into platforms. It's a trend that many of the CIOs are actually doing that. They want to, exactly what you said, reduce costs, reduce administration, have better visibility because it comes from one source, and also reduce the manpower required to manage those applications. When we go down that path, what do you think the impact is, both financially and in terms of the technology needs within an organization? How do you see the risk being eliminated or increased when you consolidate into one platform, for example?
So the risk is never going to be eliminated. It's just a different type of risk. You're going to reduce your risk, but it will never be eliminated. In some areas, the higher risk is perception of, okay, you're putting all your eggs in one basket, right? When we did, as an industry, move more toward a single EMR that consolidates acute and ambulatory, that was a risk, right? But at the same time, that was the right path to do. Then you also have the risk of putting all your servers and everything into a cloud format versus on-site and on-prem. You don't have control of it anymore, and there was a risk around that. 10 years ago, it was a little more risk averse. Today, everybody's got a EMR that's in the cloud somewhere, supported by one of the major cloud providers, and that's a risk as well. There's no right answer to this, but you are going to try to move more consolidation. You're going to reduce your risk by not having yourself dependent on it, because as hospitals, we're not in the business of technology. I mean, that's, and
Yeah.
healthcare in general, right? We're in the business of patient care. So you're going to see more and more of a trend of, okay, maybe we don't need to figure out how we need to build out our data center. Maybe we need to move more toward a smaller footprint data center and rely on better vendor partners that can provide the proper solutions off the shelf, per se, but it has to align and work with the systems that we have. And it is very complicated, right? Even if you're a small, medium, large hospital, and everybody's grown so differently the last 20, 30 years, it's a complicated environment.
Yeah, it is. As you were talking about other service providers who are mostly in the cloud, and of course, this digital transformation pushes people to use more applications in the cloud. And the cloud itself is a set of APIs connecting a whole bunch of services together. And that increases the risk because you don't know which service provider has what APIs and who they're using. It could be three steps down the line with somebody else that has a vulnerability. So how would you assess this complex integration of services with other vendors that you mentioned to consolidate, yet the risk is out there and it could be anywhere that's actually it's not seen and it's not clearly understood. So how do you go about a supply chain, let's call it, monitoring security and adjusting to the ongoing challenges that cloud is bringing in?
So if you're a smaller organization, you want to learn from the larger ones who can invest more into this, right? They're going to be working with the consulting firms that are doing a lot of that higher level analysis to do the risk assessments. So as an example, any product has to go through a security risk assessment. It's, whether you're SOC 2 compliant or whatnot, and making sure that those things are covered, HIPAA certified, et cetera. There's all these different things that in the world we live in. High trust is another one. So as long as those things are checked off, that's reducing that risk element. And you're going to do referrals. We do that all the time. If we know ABC hospitals using it, then we're more likely to try to use it. Now, the challenge is when are you the guinea pig, or when's that first solution being deployed? Now, there are some hospitals that are leading edge and they have the funding, they have the innovation mindset, and they're going to be able to pilot it. So once they get through that initial pilot, then the others can benefit from that. So we're always looking for referrals, and there is no 100% risk averse situation. Like you said, there's going to be third parties with third parties. You don't know where your data may flow sometimes, but that's where you have to look at your service level agreements and your initial contract agreements, and seeing how that data is going to be used, if it's going to be sent for anything else.
So, having said that, what do you recommend for, let's say, a mid-size regional hospital or mid-size healthcare organization in general, if they don't have the necessary resources to apply the same technologies and learning that the larger organizations have done? How do you go about getting that information and applying it to their own institutions so that they can move forward? What's the process of doing that?
I mean, there's two avenues. One, you can always hire third party consultants, right? That's certainly one avenue. And then through that, you can even do fractional work. So you get IT leaders who can provide advisory services on a fractional basis. And then the second area is making sure your organizational leaders are out and about attending conferences where their information is being shared. That's where they're going to be able to learn about other products without the same level of spend you might with a big consulting firm, but by attending these different types of events and finding out, okay, looks like they're having, because most hospital healthcare systems have similar problems. It's not rocket science. I mean, we all go through the same changes for the most part. 80% of everything we do is somewhat aligned. And every year we're going to make some incremental changes. So you can learn from one another. And the only way you're going to learn is if you're out there meeting other people in your own industry, organizations, through healthcare IT. There's plenty of them. HIMSS is the largest one, probably. Then you hear about Chime, and now you hear about Vive and Becker's Health. There's so many that are out there, right? There's so many options to choose from. And as you participate in each of these, you're going to build relationships, and you can reach out to more people that you can, phone a friend, basically. Hey, I'm considering this type of solution. I'm having this problem. Have you ever heard of this? And then just have a conversation around it.
So, going back to the topic of trust and how do you establish trust, what is your advice to other industry leaders who are listening to this podcast? To how do you, what do you, what's your advice for them to create trust and build a culture of trust within their own organizations?
I mean, the culture of trust is being present. The leaders have to be present more. And there's a market shift, right? When COVID happened, everybody went remote, and then everybody wanted to stay remote. And now you start seeing hybrid or maybe even on-site becoming more of a requirement. In a healthcare situation, you're providing physical patient care. So being on-site has a different meaning, even from a technology support perspective. Being present is how that changes things. So you can provide a lot of work and what we do today in a remote capacity. Both of us are remote right now. Okay. So that all is capable anytime, but you have to still get in front of people physically as much as you can. I'm a firm believer that there's probably 15% of productivity lost by not being in on site. So it doesn't mean you can't work offsite, but there are things that you just never will discuss because you're not walking with somebody to get coffee and having just a random sidebar conversation that you were able to solve in 30 seconds of walking with somebody. And so there is a lot of these things that can get done more effectively if you're meeting people. And then you build that trust because seeing people makes a big difference. It's the same reason why business airline travel will likely never go away, because people want to see each other in front of each other and build and have those conversations where you are going to open up more with, all your different staff levels, and then being able to periodically, take coffee breaks or meal breaks of any kind. And that's where you're going to build a culture of trust. is getting everybody to share more in different capacities or different ways.
Let's focus on that a little bit because I was thinking that as a fractional CIO, you see a lot of organizations that probably are trying to support both remote users and on-premise users, and I would say also assets. So when you get a healthcare organization that has diversified assets, remote users, remote assets, on-prem users, and on-prem assets, what is your recommendation for them to be able to service their patients securely? Because obviously it's a very sensitive issue in healthcare, which is one of the most regulated industries with HIPAA, PCI, GDPR, and the like. Regulatory compliance is a big issue. And now, of course, as you suggested, you've got the remote users and you've got the people who go to the office. And that creates a bit of a challenge, both in terms of patient care and secured patient care, which is more important because you don't want to have any breaches and risks that exposes patient data. That's very big. And also the trust established by the patients and the institution to make sure that they feel comfortable that their healthcare organization is secure and they're secure, and that trust established as such. So how do you see that over time as the technology is changing? One of the roles that you play is digital transformation. How do you bring digital transformation, secured communication, focused on patient experience and secured patient experience?
There's no single answer for that, but I think what you're going to have is like an onion layer approach. So in the middle of the world is the patient and the patient's data, and then you have different types of security solutions that surround that in different layers. And every hospital or any organization for that matter has different things to consider, right? Whether it's firewall protection, email filtering, etc. I mean, there's all kinds of things that you can put around it. So whenever we go out and we're talking about different solutions that we're trying to provide or sell or even look at, the first thing is security has to be table stakes. Here's what we do, here's how we provide it. And if we can't get beyond that in a few minutes, nothing else is going to matter, right? So whoever you're trying to either sell to, or whether it's an actual customer or a patient, which is your customer too, if they don't feel that trust based on how you manage data today, they're not going to want to move forward with the next step, whatever the next step might be. So I think it's being able to say we are doing what we can from a security standpoint. Here's the basic thing, whether you're SOC 2 compliant, high trust certified, et cetera. There are different things that you can say you have as an organization. And then from there, you still have to show how you're doing it. Isolating of data is a big challenge, right? In the world of FinThrive, as an example, we have different customer data. We have to make sure it's all isolated. So if there's a breach, even within their own organization, it doesn't breach other organizations through us, right? So we have access and you have to make sure it's delineated. So there's a lot of different factors that have to be considered. And this is where you are going to be dependent on environments that are secure. So whatever type of virtual desktop environment you're using, Azure AVD right now is the one that we end up using sometimes more than others, but there's plenty. There's many options that are out there, right? And so now you can bring it up and it's in a container of some sort, if you want to call it that. And so you're only accessing data through that secured container, and therefore it can't go elsewhere. Now, there are workarounds. Of course, there are. Criminals are always looking for that. But all you can do is protect as best as you can, because with the mindset, and you always have to be on guard. There's a blog that I listen to every once in a while. His name's Drex DeFord, and he runs what's called a 2-minute drill every few days. And it's like what's happening every week in 2 minutes. And he just kind of talks about it. And he ends his podcast every time with stay a little paranoid, right? Like the reality is stay a lot paranoid, right? We have to assume somebody's trying to attack us. And in the business world, that's the way you got to look at it.
For our audience, could you elaborate a little bit more about what FinThrive does and how it helps customers?
Yeah, so we're a revenue cycle platform. And so when you think about patient care and what it takes for patients, they get registered in a hospital, they get a service done, and then at the end you get a bill. All throughout that, there's elements of how payment is going to be managed, and that's what's called revenue cycle. So up front, you're getting your eligibility requirements, your registration for patient, making sure insurance coverage is there, and then you actually have the service You get billing and coding and submitting of all the charges. And in the back end, you get the claims and making sure the claims get submitted properly to the payers, and then the denials are adjudicated or appealed appropriately, because they're going to try to deny it and delay it, and just making sure you get to that final adjudication to receive the collection of revenue that the hospital or providers are due. All throughout that healthcare process, there are different applications, SaaS solutions, as well as services, but a lot of technology that can be applied to improve that. And that's the world we live in. So we have a revenue cycle platform that is helping hospitals becoming more efficient.
We talked about the ecosystem and how the different systems have to work together in order to provide the patient experience and be able to service the patients the way they should be serviced. And this is one major component of a much bigger ecosystem that includes patient healthcare. It's a very important part because as a patient myself, I go through that experience and I always think, okay, what touch points do I have across this whole ecosystem that I can easily manage, monitor to make sure that I'm okay with? So this actually goes very well with the topic of complexity of healthcare system across, on-prem and cloud applications, integration of all of that as a healthcare technology. Having said that, do you integrate with other applications to kind of touch on that topic, that how complex the system is getting, but it's uh, uh, but it's doable and it's being done very effectively. How do you work with other applications, whether it's on-prem or in the cloud, and how complex are these integrations?
I mean, the ideal way you want to do is it all should be within one application. There's less integration. But the truth is, you have hundreds of applications. Whether it's in the cloud or on-prem, it's a minor difference today. It's an API that you're putting together and collecting data, and as long as the path is open and secured to get it, you're going to get it. So yes is the answer. We do always do a bunch of integrations. When I was with a large healthcare system, we were known for having the largest interface engine in the world. Okay. So a lot of data flows through interface engines, good or bad. It's how we have to provide data. There's some regulatory requirements, state reporting, etc. Data has to flow for different needs, different process needs. So our goal these days today is, though, can we do it without another integration, if at all possible?
Yeah,
Because it just keeps growing and growing, getting more and more complicated, and we really want to do less is more type of
that's
thing.
not
So
perfect.
there's no right answer to this, because sometimes you have this new solution, which is great, and you need it. But do you want to integrate one more add-on, or is it just something that you will keep separate and manage it in a different way? So there's no right answer, but ideally you're going to want to assess it to see, is this something we really have to have? And then yes, we'll add it to the interfaces.
Yeah. Well, we've reached the end of our time for this podcast. I want to thank you for your valuable insight to healthcare tech. Appreciate your time from Xenex and all of us. I'd like to thank you for sharing this information with us.
No, thank you, Kevin. It was a pleasure today. Nice talking to you.
All right. Thank you.